Hello, and thank you for joining us for this presentation by Will Cabanella, Hannah Carrion, Claire Demopoulos, Angel Hermawan, and Yuntek Mak. In this presentation, we will be discussing how to care for Parkinson's disease. Here we would like to first acknowledge all those shown here, and especially our Professor Jung-Ah Lee for her guidance and support in this project. In this presentation, we will be discussing what is Parkinson's, what are the causes and symptoms of PD, how do you care and manage for the disease, and what resources and support is out there. So what is Parkinson's? Parkinson's disorder is also known as PD. It is a neurodegenerative disorder that affects predominantly the dopamine-producing neurons in the brain. Symptoms generally develop slowly over the years. The progression of symptoms is often a bit different from one person to another due to the diversity of the disease. The cause of PD remains largely unknown, and there is no cure. While Parkinson's itself is not fatal, disease complications can be serious. The CDC rated complications from PD as the 14th cause of death in the United States. It is definitely possible to have a great quality of life with PD. The first step to living well with Parkinson's is to understand the disease and the progression. Working with a doctor and following the recommended therapies is essential to successfully treating symptoms.
So what is the cause of Parkinson's disease? Essentially, what is happening is dopaminergic neurons in the area of our brain called the substantia nigra start to die. If we look over here in the zoomed in area of our brain, we can see that the substantia nigra in non-Parkinson's patients has a dark lining of cells. But if we look at Parkinson's patients, these dark lining of cells start to disappear, which basically represents that these neurons are dying. As a result, there is less dopamine being produced in the brains of those with Parkinson's. But the thing is, dopamine allows our brains to control our fine motor skills, or in other words, allows us to have accurate control of our movement. Dopamine does this by transmitting signals to various areas in our brain that are important for facilitating movement. Without dopamine, we lose our ability to accurately control our movement. This is why Parkinson's patients get symptoms of tremor and other movement issues because they have problems accurately controlling their movement due to the lack of dopamine. So what is causing these dopaminergic neurons to die? The cause seems to be multifactorial, but research has been suggesting that age, gender, mutations, chemicals, and brain trauma are likely risk factors for the disease. For example, as someone gets older, they increase the risk of developing Parkinson's disease, and the average age they are typically diagnosed is around 60. As a result, a lot of people tend to think of Parkinson's disease as an older person's disease. However, some people can get Parkinson's at age 50 or even younger, like the actor Michael J. Fox. Men are also more likely to develop Parkinson's disease, with 50% more men being diagnosed with it than women. Various mutations in our genes have been shown to increase the chances of you developing Parkinson's disease. Chemical exposure from pesticides, herbicides, and heavy metals have also been shown to change your neurochemistry and physiology of your brain, which basically affects your dopamine production. And lastly, traumatic brain injury has also been shown to increase your risks of developing Parkinson's disease due to changes in your neuroanatomy after the brain injury. There are also some protective factors that I listed on the right that have been shown to reduce your chances of developing Parkinson's disease. These protective factors include stuff like physical activity and caffeine to help stimulate the brain, and NSAIDs, or non-steroidal pain medication like ibuprofen or aspirin, also seem to protect dopaminergic neurons from damage due to their anti-inflammatory properties. Great. So now Angel is going to talk to us about the signs and symptoms of Parkinson's disease.
Signs and symptoms of Parkinson's include tremor, usually seen in the hands or fingers, slowed movements, also called bradykinesia, rigid muscles limiting range of motion, impaired posture and balance, issues with sleep, loss of automatic movements such as blinking, smiling, or swinging their arms as they walk. A person's speech may also change. They may speak more softly, quickly, slur their words, or hesitate before talking. A person may also go through writing changes, and it might be harder for them to write. This image is an example of what a person with PD's writing may look like. Their writing may appear smaller, and you can see the letters look shaky, which is due to the tremor in the hands. Now we will be talking about the care and management of Parkinson's disease. An important part of caring for a person with PD is fall prevention. Because this is a movement disorder, people with PD are at a high risk for falls. The first part of fall prevention is making the home safe. This is important because the majority of falls actually occur at home. Make sure to keep the floors clear of clutter. If there are small throw rugs on the ground, in order to keep them from slipping, remove the rugs or apply double-sided tape to secure them to the ground. Install grab bars next to and within the tub, as well as close to the toilet. Install handrails and lighting on all stairwells and make sure the house is well lit. You should also make sure the person with PD keeps moving. Activities such as Tai Chi, which helps promote balance and strengthen the legs, can help prevent falls. Exercise and movement can also improve your loved one's mood and confidence. Consult with our healthcare provider to determine the best form of fitness regimen for them. Speaking up as a care provider and having open communication is also a part of fall prevention. Have conversations with your loved one and their healthcare provider about the risk of falls and how to prevent them. If your loved one has fallen, is afraid of falling, or appears unsteady, contact the healthcare physician right away. Keep a list of your loved one's prescriptions up to date. Show all of their drugs, including over-the-counter medications and supplements, to a healthcare provider. Any negative effects of medications, such as dizziness or sleepiness, should be discussed because those are factors that may contribute to increased fall risk. Ask their doctor about vitamin D supplements for better bone, muscle, and brain health. Lastly, have your loved one's eyes and feet checked. Fall risk is reduced when a person can see clearly and walk comfortably. At least once a year, have their eyes examined by an eye doctor. As needed, replace eyeglasses. Also have their feet checked once a year by a healthcare provider. Discuss correct footwear and whether or not a visit to a foot specialist is necessary.
Pop quiz time. Do you think this statement is true or false? Exercise can improve gait, walking speed, and balance. And in case you didn't know, gait is a person's pattern of walking. This statement is true. For short-term improvement of PD symptoms, consistent rehabilitation practices for 2 to 4 weeks is recommended. Evidence-based exercise recommendations include physical training, multidimensional physical therapy, treadmill and cycling training, and resistance training. Some of these exercises are meant to be done with a professional trainer, but resistance training is one form of exercise that can be done at home with the supervision of a caretaker. Resistance training, also known as strength training or weight training, is the use of resistance to build the strength, anaerobic endurance, and size of skeletal muscles. The image on the bottom right shows how resistance bands can be used to strengthen the muscles in the legs. This form of exercise is recommended to be done 2 to 3 times a week with the supervision of a caretaker. Next, we will be discussing how caretakers can support people with Parkinson's disease in their daily activities.
Okay, so my name is Yunton Mack, and I will be going over treatment management support with daily activities. So I have a few bullet points I want to go over today: eating, bathing, toileting, brushing teeth, and grooming, and driving. Let's start with eating first. So if a Parkinson recipient that is having a hard time eating, we want to cut the food into smaller pieces. And next, we want to help to set up 90-degree angle for the recipients. Then once we start feeding them, we want to tilt the recipient's head slightly forward when feeding. Always remind and make sure the recipient is concentrating on swallowing frequently, because we don't want to feed them, smaller portions and they're not swallowing, then it can accumulate, which can cause them to choke, and we don't want that. So always make sure the recipient is concentrating on swallowing and swallowing frequently. Okay. Next, what if the chewing becomes too difficult or tiring? Then we want to use a blender If the food is too hard to swallow, blend the food into the blender, make it look hummus looking. So the picture to the right on the top is carrot. This carrot has been blended into blender, so now it looks hummus looking, which is easier for the recipient to swallow. However, sometimes the recipient have trouble swallowing liquids. Then we want to use a liquid thickener for the recipient. A liquid thickener, all we have to do is put the content of liquid thickener into the liquid and give a few minutes. The liquid will become more solidified, like a hummus looking, and it will have the same result. Then it will be easier for the recipient to swallow. Next, we have bathing. So bathing is really important because we know Parkinson recipients, they have, muscle weakness, hard time getting in and out of the bathtub without proper support. So we want to install handrails for the recipients. The handrails, we want to make sure they're both installed in the bathtub or the shower stall. There should be at least 2 handrails to hold on as the recipients get in and out. Next, we want to also make sure to place non-slippery rubber mats in the bathtub and shower stalls to prevent falling. This is really crucial. Let's look at the first picture to the bottom left. That is a non-slippery rubber mat. Number one rule that we when they're doing daily tasks that we want to look out for is falling. So in order to prevent falling, we need to have these resources available for them. So non-slippery rubber mat, we can get it anywhere, Walmart, Kmart, even on Amazon. And the picture in the middle is a shower stall. As we can see, they have a long handrail. This is for the supporting system for them to get in and out. And the last picture, which I really like the most, is because this handrail and the bathtub is slightly tilted outward. So the recipient have an easier time to hold on to with both hands getting in and out of the bathtub. I really recommend one of these because it's really, really helpful and easier for them to finish their daily task. Next, we have getting dressed. So getting dressed is important. We want to make sure the recipient is getting dressed at the proper time where the medication is working the best. And while the recipients have the best mobility to get dressed, while getting dressed, what we want to do is have them to sit down when getting dressed. We want them to choose a chair with a firm support and arms. So we have the picture in the middle, that's chairs for Parkinson patients. So as we can see the chair, it is firm and it has 2 handrail support. For this, once they sit down after they get dressed, it's easier for them to get back up. That's what the handrail is for their support system, because Parkinson's disease can cause recipients to have a hard time getting up. We always want to have support, right? So if one arm or leg that have weakness or stiffness, they're having trouble to put it on themselves, or they're just having trouble in general, we want to put on the sleeve or the clothing on that specific part first. Have their limb into the sleeve of the pant first. Make sure to take the time for the recipients to get dressed. This is very important. Being in a hurry will worsen Parkinson's syndrome. A lot of the recipients, when they're getting dressed, they get frustrated because they're tremoring, they have muscle weakness, and they feel like they can't do it. They get really frustrated, and that can worsen their Parkinson's symptom. So always make sure they take their time to get dressed. Okay. Next, we have consider adaptive closing tools. So we have 4 types here. We have a button hook, zipper pulls, dressing stick, and a socket helper. So the first thing we have is a button hook. A button hook, basically, if we're wearing anything that have buttons, shoes, gloves, dress shirts, we can use the button hook. The end of the button hook can attach to the button, and all they have to do is just slide it over, okay? And they just put on the button. And then for zipper pulls, we want to help move the zipper slider up and down. So the zipper pull is very self-explanatory. All they have to do is just attach to the zipper and just go up and down, slide up and down. And we have a dressing stick. I recommend each recipient can get one of these because this is to help reduce bending, twisting, and reaching forward. We don't want to put strain on their back, especially when they try to put on socks, their pants, even underwears. We want to have one of these. It make life a lot easier for these recipients. And sock aid helper. A sock aid helper is just to help you put on socks. You slide your foot into a brick system and remove the brick. The next, you have the socks on your foot, right? Then what we want to do is have the dressing stick. The dressing stick, go ahead and manipulate between your socks and the foot and just pull it up. And that works with pants too, or shoes. Okay, so they have these all on Amazon and a lot of retail stores. They have these. I recommend they all, each of the recipients can get one. It makes life so much easier for Parkinson's disease. Okay, while dressing. Next we have, so a lot of us wondering what to wear. So first thing first, I want to say wear non-slippery stuff, especially for socks. Wear non-slippery socks, non-slippery shoes. We don't want them to fall. Right, it's like bathroom slippers is a no. Do not wear bathroom slipper because it can become slippery and they can fall. So a non-slippery socks is the picture to the right over here. That is a firm socks that is not slippery, and we want to have one of these. And for shoes, we want to wear shoes that have straps, support straps, and elastic shoelace, and shoes that can be slip on, because we want to have easier time for the recipient to slip on. We don't want to have shoelaces, they have to tie it. That take too much work for them. So just easier to slide on, easier to put it on, elastic strap, done. Right. We also want to wear pants with elastic waist. So like sweatpants, pajamas, like elastic waist. We don't want them to have we don't want them to wear belts. We don't want them to wear on buttons, zippers. That is hard. So some adaptive clothing companies sell these specific clothing. Can be ABL Demi, ABLY Apparel, Buck and Buck, Keysix, Bexley, Tommy Hilfiger Adaptive, etc. So one of the picture I have right here is Buck and Buck. They sell specifically these sweatpants that are elastic waist, and these are very easy to put on, and they also have shoes too for elastic straps. Okay. However, I do want to mention we want to avoid socks with elastic bands. Okay. Next we have toileting. So toileting is very determined on how tall or how tall the recipient is. If the recipients are, so let's say for C, we want to have an elevated toilet seat first. I'm sorry, that's what I want to say. So we want them to sit on the elevated toilet seat. That way it's easier for them to get back up, so they don't have to sit all the way down, and they need more energy to get back up if it's not elevated. So the next thing we also want to have is handrails next to the toilet seat, because they have muscle weakness, and what if they cannot get up so we need to have the support system for them. So install a handrail next to the toilet seat so they can be able to get up. So the first picture here is an elevated toilet seat. So it's very easy. You just go ahead and install upon the already existing toilet seat. Next, we have the handrail. I want to show these two pictures together because one handrail is actually lower than the one at the right. This handrail is usually for the shorter recipients. They don't need such a tall handrails. And for the longer handrails over here are for taller recipients that they need to get up. Okay, so this is for toileting. Number one rule, provide stability and easier time for them to get back up. Elevated toilet seat and handrails. Okay, next we have brushing teeth and grooming. So for brushing teeth, definitely have the recipient sit down. This helps prevent patient from falling and conserve energy. We want to get them an electrical toothbrush. They don't have to use their arm strength. Just go ahead and put it in their teeth, and electrical toothbrush does the job. And for grooming, same thing. But we also want to prep their elbows on the vanity and the sink when they're shaving, combing hair, or using a hair dryer. Have an electrical razor and hands-free hair dryer that can be mounted on a vanity. So here's some picture I want to see. So this is electric razor, and the picture on the right is a hand-free hair dryer mounted, put on the thing. If they're home alone, all they have to do is just press the button. That's all. Next, driving. Yeah, a lot of people wonder if driving is still possible. It's a yes and no, because driving is definitely possible in the early stage of Parkinson's disease with medication, of course. But we want to make sure they're staying fit and active while they're driving. you want to make sure they eliminate any driving distractions such as cell phone, text messages. They should be put on silence. And do not drive when they're feeling fatigue or medication is start to wearing off. If they're tired, they should not drive. Okay. They want to maintain a good posture while driving, reduce their back strain. So by reducing their back strain, we have several methods. So we have something called the lumbar support cushion. This picture in the middle right here, a little bit to the right, we can get this anywhere. Any retail store sell these. Just get one, put on a car, and help them sit up straight once they drive. However, the next slide I want to talk about the most important for Parkinson patients who want to drive. So what we want to know, so what do we need to prep? What do we need to know before they can drive, right? So even though they can still drive, however, the determinant factor is if they still have the adequate reaction time. And if they're able to turn steering wheel, if their hand muscle strain, if they still have the strain to turn them, or if they still have the strain pressing down the brake and gas pedals. That is really important for these determinant factors, okay? And so these are all I want to talk about today, and thank you everyone for listening. Now I will go ahead and pass down to William, and he will be talking about diet and nutrition, okay? Thank you guys so much.
So even though there is no diet out there that can treat Parkinson's disease, making sure the person who is experiencing Parkinson's has a well-balanced diet and has good nutrition is crucial in helping them maintain overall good health, and it can also help ease certain Parkinson's symptoms. For example, there are certain Parkinson medications that can cause dehydration. So drinking 6 or more cups of water a day can help you stay hydrated. Eating lots of fibers while drinking a lot of water can also help stimulate your bowel movement and prevent constipation. Bone health is also really important for Parkinson's patients as well, since bones are important for movement, posture, and protection. This is why these people need to make sure they're getting enough vitamin D in their diet through milk, eggs, and fatty fish. As Parkinson's progresses, the patient may start having trouble swallowing food. So eating soft foods, eating slowly, and taking smaller bites may also help with this. Adding seasoning, sour, and carbonated food may also stimulate the swallowing reflex as well. Some patients may also experience muscle cramps. So staying hydrated and consuming yellow mustard, tonic water, pickle juice, and salty or vinegary foods may also help reduce or prevent muscle cramps. And lastly, since Parkinson's disease is a neurological disorder, eating foods that are rich in antioxidants can help maintain brain health. Some of these foods include stuff like nuts, berries, salmon, tuna, and dark leafy green vegetables. Awesome. So now Claire is going to talk to us about therapeutic communication.
Now we will be talking about therapeutic communication with geriatric patients with Parkinson's disease. One thing caretakers should do is face their patients so their mouth and face are visible. It's also important to be respectful and address patients by their proper surname, such as Mr. Smith, and avoid using the patient's first name, unless they prefer that you call them that. Speak clearly and not too fast, but don't shout. Shouting does not help the patient hear you better and can actually distort your speech. Lastly, it's important to focus on one topic at a time.
The next topic for caring for those with PD is to also acknowledge their mental health. Being diagnosed with PD can be difficult for anyone to deal with. Knowing where to get support is crucial. As I will expand on in the next section, there are many online communities to connect with and find support that include but are not limited to support groups and a special hotline specifically for Parkinson's-related questions. Resources, information, and support. This is a list of a number of resources that can help support both people diagnosed with Parkinson's and their caregivers. I would just like to reiterate that this is not a comprehensive list. The first is the helpline. The Parkinson's Foundation Helpline has specialists such as nurses, social workers, and health educators that help people with Parkinson's and their caregivers navigate every aspect of PD by offering emotional support, sharing current PD-related medical information, and guiding callers to local resources. The helpline is available at 1-800-4PD-INFO. The next resource is the Parkinson's Hospital Kit, which is offered by the Parkinson's Foundation. Since people with PD face great risks in the hospital with frequent hospital visits and a high sensitivity to the timing and dosing of PD medications, the Aware and Care Hospital Kit protects, prepares, and empowers people with PD before, during, and after a hospital visit. The kit contains tools and information to share with hospital staff during planned or emergency hospital visits. On the right, you can see a list of all the items that the kit includes. Several of these items can be found on the website for free and be shipped to you for free. And the items with an asterisk are also free with an $8 shipping charge. PD Conversations is an online community forum where you can ask for PD-related questions, connect with others living with PD, and be a part of a supportive network. You can also find various discussion groups to find answers to all of your questions. And lastly, here are a list of other beneficial resources of support for those diagnosed with Parkinson's. These are our references. And lastly, we thank you again for your time. If you have any other questions, please feel free to contact our professor, Jung-Ah Lee.